I think the jail is just, I'll just say, f***ed up. They've had so many suicides. They've had so many issues around this where they're not supporting the people that they're trying to take care of because they've broken the law. That needs to change.
There are around 16,000 inmates in South Carolina, and nearly half have mental health issues. But jails are not hospitals, and deputies are not doctors. I'm Nick Reagan, and today I'm sitting down with investigative reporter Emily Johnson to discuss the mental health crisis behind bars in this Live 5 Deep Dive. Emily, who is Forrest Kreider?
Forrest Kreider was 33 years old at the time of his death, and he's originally from Michigan, but his family kind of describes him as a nomad a little bit. He traveled a lot around the country, kind of did odd jobs here and there, and that's what brought him down to the low country. He also was a really talented man who worked with wood, kind of a woodworker, and his dad just was really proud of the sculptures his son made.
He was fun, just liked to have fun, liked to play a lot, was sort of physical. Had a strong will, definitely, and really had the sense of what right and wrong was as a kid.
He was arrested for assault and battery. That was on January 4th, 2024. And this was, at least as of my research, his only time being arrested locally. But his parents did say that he was a little bit more troubled. He definitely had problems growing up with authority, with, figures in places of authority. And so that they kind of speculated kind of brought him to where he ended up and why he ended up being charged. And that kind of led to this domino effect, I would say.
A strong sense of right and wrong, as well as sometimes trouble with authority figures. These are kind of telltale signs of somebody that is struggling with some kind of mental health concerns, right?
Correct. And Forrest, I don't know his official diagnosis and what specific type of mental health and illness he was facing, but his dad did say that he was self-medicating a lot, often with marijuana, which is pretty common in mental health illnesses. And so he was trying to, use these substances to kind of keep his mind off of his problems. But once he got in the jail and behind bars, he obviously could not use those resources and substances any longer.
But going back further, he had always had some kind of mental health concerns, and his family, were they able to help him at all, or was it a struggle addressing his mental health needs?
They tried to help him, and because he was a little bit of a nomad, helping him was maybe a little bit more difficult because he wasn't always near them physically. And when an individual is traveling around that often, maybe they're not always answering the phone. Maybe they're not always responding to calls for help or asking for help necessarily. And so his family did say it was a little bit harder to know exactly what he was suffering from because he wasn't always open about it. And unfortunately, that's a very realistic reality when it comes to people who are suffering from mental health illnesses, is not wanting to talk about it and not wanting to speak up and say, hey, I need help.
He was a strong-willed adult, really spoke his mind, and with the struggles he had with mental illness that were there that we tried to support with, but he was really firm about, I don't want to be medicated. That kind of scares me. I think it was out of fear more than anything else.
He was arrested, and inside the jail, that's when things really started to deteriorate. Lay out the timeline for me.
So he was arrested in the beginning of January 2024. Then we fast forward to April 2024, and that's when kind of everything started unraveling in a way. And it was on April 23rd, 2024, when Kreider used a chair and a bed sheet, and that's when he attempted to kill himself. And authorities and members of the jail quickly rushed him to the hospital. But unfortunately, he passed away the next day.
Suicide is always complicated, and there aren't always signs. But were there signs in this case?
For months up until his death. In February, he had reported feeling depressed. And that's when he spoke with medical providers. And they told him, hey, maybe try some yoga. Maybe try and get outside, socialize a little bit more. And then we fast forward to April, beginning of April, and he had self-reported that he had a mental health disorder. It is also important to note that when he did get in the jail, he refused to take any medications. He said he had not had a great reaction to some of these medications before for mental health. So he was not actively taking any prescriptions.
Well, and that was something that his family had brought up as well, that they tried to get him medicated and tried to give him medications, but he was very adamant about not wanting to take medications. Tell me about the days leading up to his suicide attempt.
Well, directly the day before he committed suicide, he had completed the psychiatric evaluation, which basically it was giving a full recap of what he was feeling inside to medical providers. And in that report, he said he was feeling very depressed about feeling homeless. He felt ashamed and depressed to his family that he was in the situation that he was. And he did voice these concerns, and medical providers actually did get him on a new medication the day before he died. But if we rewind to what we were just talking about, he had also voiced these concerns in as early as February. He'd voiced these concerns in April that he was in a depressive stint, yet was allowed to go back into general population. So he was actively voicing these concerns. He was not only saying this happened to be feeling this way the day before he committed suicide. It was kind of an ongoing problem that he was voicing.
And not just to jail staff, but to his family as well.
Exactly. His father said that he knew that he was going through this episode.
He told me he was feeling down, you know. He had said that in the last phone conversation I had with him a couple of days before that. I was really angry and upset that, you know, he'd be unsupervised knowing he'd come out and said he was depressed. So I tried to reach out to as many people as I could, calling the jail, calling the head of the jail. And they, you know, obviously had to talk through their stuff and really not tell me much. So they're really nothing. I didn't know a lot for quite some time. I mean, the people at the jail were not helpful at all.
Emily, suicides are rare, but we do see a lot of these mental health issues in jails across the state and prisons as well. This case in particular has shined a light on the problem. What has your investigation revealed about just how big this issue is?
This issue is massive. From talking to different local authorities who work in jails, they've said at least almost 50% of the general population is suffering from some sort of mental health illness.
There are a lot of people in here that have mental health issues, and there are varying degrees of mental health issues as to we have people with mental health issues that are functional, that you wouldn't even know they have mental health issues, and we have people that are really sick.
The Charleston County Jail, which is kind of who we spoke with about these problems, they said, we do a screening when inmates come in, but if they're not voicing these mental health concerns, it's impossible for us to really know.
Just numbers-wise, we actually administer 17,000 medication passes a week in here.
In your interviews with staff at the jail, how do they describe just having to deal with not just mental health issues that they may or may not be prepared to identify, let alone treat, but also dealing with the inmates themselves?
They said it's a really large burden also placed on the jail staff and the deputies that are not trained to help people in mental health situations. They were trained to help people that were incarcerated, providing them, you know, basic human needs. And this has kind of taken their duties to another level.
That's frustrating. We try to give them some dignity and some quality of life, and these folks are sick. So, you know, we do what we can when they're here.
But they also know how important it is to address these problems. They don't want people to be committing suicide in their facility. They want people to be getting strong enough mentally to be able to go forward with their court cases. But the problem is it's the lack of resources, really, and the lack of almost discussion about these individuals, because one of my favorite quotes actually from one of the administrator of the Charleston County Jail, he said, just because the general public cannot see these individuals does not mean this is not happening. They are removed from the public. We can't see behind those bars, literally. But these problems are still happening there, just like they are happening throughout America right now with mental health crisis.
Talk to me about what your data found in terms of how many suicides there were and any other suicides that you have become familiar with through your investigating.
Well, we found from 2015 to 2021, 80 inmates committed suicide in South Carolina prisons and jails. Obviously, that is not including the last 4 years, which I would speculate is a lot higher after the pandemic. We've seen other cases of inmates committing suicide in just low country jails. Jordan Bell committed suicide the same year that Forrest Kreider did. And it was almost very similar in a different way, but he was voicing these concerns, and he actually was cleared for off of suicide watch the day before he committed suicide.
Nearly half of inmates have some kind of mental health concern. Shouldn't there be some kind of mental health professional staff in these jails? Are there?
There are in the Charleston County Jail, and it's been a newer initiative. They have a behavioral health unit, which is more for, they would say, like an emergency mental health case, but that can only fit 20 individuals. And when you look at how many people are held in that jail, that is not a lot. And they know that. They've admitted that. They're trying to up their resources. But a lot of the more rural, maybe smaller jails throughout the state don't have an open verbatim mental health resource facility or center, including Berkeley County Jail. We got information from them, including Dorchester County. They don't have a specific behavioral health team or unit that can help these individuals.
Now, there is a mental health hospital for inmates in Columbia, right?
Correct. And that is the forensic hospital. Basically, it is really just helping inmates. But for an inmate to be able to go to that facility, a judge has to deem that they are basically not competent enough to stand trial. And so they are given a competency restoration treatment order from a judge. And that really, in easier, simpler terms, means making sure somebody is mentally stable enough to be able to understand their case, understand what they're going through, understand their rights before they can stand trial.
But that is a judge saying this inmate is so challenged by their mental health issues that they need specific medical intervention, and they can basically only get that in Columbia.
Exactly. And that facility only has 200 beds. When you look at a state problem, 200 beds is nothing. And they know that. They say, hey, we wish we could offer these services to more individuals, but even if they had more physical space, they said, we could maybe fit 500 people in this facility, but we don't have enough licensed psychiatric physicians or therapists that are willing to work in these facilities and willing to help these individuals. So that's almost the larger problem than just the simple physical space that is available.
And there's a wait list.
Oh, yeah. The wait list, I mean, it is, I got the most recent report from a month ago, and people had been on that list for over 200 days. People inside the Charleston County Jail have waited for almost a year.
And these are people that a judge has already said need strong mental health professional care.
Exactly. And one of the more interesting things is, and I know we've discussed it before because we've taken a look into the criminal justice system in many different facets over the last few months, but the court backlog, which we know, there's people in jail that have been sitting there for years waiting to get help. But the problem is, a lot of the times, once an inmate is cleared off of this list and actually gets the services in this Columbia facility, they come back, they might have to wait another year or two before they're even before a judge again. And when you think about that, and the different providers at the jail said, then they're going back. They get all this help and assistance, but then their mental health starts to deteriorate again because they're not getting the same resources that they were at that hospital in Columbia.
So this is a problem that state leaders know. They have seen, I'm sure, jail administrators and sheriffs across the state have raised this concern. And there are some solutions coming down the pipe that some are already being implemented. What did you find in terms of these solutions and how fast they're being rolled out?
That's a great question, Nick. One of the more interesting things is when we're talking about these competency restoration orders where people could traditionally only be serviced in Columbia, there are local jails that can implement those programs. Aiken County is the only one in the state that has so far implemented it, but they're seeing great success per DMH. They've said it's speeding up their backlog. It's helping us in Columbia as well, not having to help inmates from Aiken specifically. And they worked with DMH to make sure they had the right people in the facility and were professionally trained well enough to be able to provide the same resources as they can in Columbia. So the Charleston County Jail is also trying to implement this restoration treatment program. But to be able to do that, they need more staffing. Because they're already understaffed, which we've covered in the past, they're not able to add this new level almost of treatment in-house until they can get more staff. And that also comes down to medication over objection. There's a few different things that also have to be basically approved before they can work.
What does that mean?
That means it's also a law, but basically if somebody is deemed incompetent or needing basically mental health medications, a correctional institution or mental health facility can say, we are giving you these medications even if an individual either denies or can't physically understand or mentally understand why they need these drugs, essentially. And there are a lot of different hoops they have to jump through. It's not like they can just suddenly say, you have to take this drug. They have to get approval from a family member or their legal counsel, essentially. So it sounds scary before you kind of understand how many things have to be approved, but the Department of Mental Health has said this really does help people be restored, is making sure they're consistently taking these medications that can help them in the long term, in the long run. And so being able to enforce that medication over objection, which they can do in Columbia in this facility, if they can add that and almost team it with the restoration program, it can hopefully show great success.
No, I mean, that's something that maybe could have helped in Kreider's case.
And that's exactly kind of why we interviewed Forrest's dad. And he, like any parent, was at first really afraid of talking about it. It took me some negotiating to tell him why I think his voice was important. And we can speculate, but for all we know, if these resources had been there, he would be here today. Jordan Bell would be here today. The 80 inmates that had died from 2015 to 2021 could at least have had better treatment and could still potentially be here today.
The state has an obligation to care for anybody in their charge.
Exactly.
Right?
Exactly. It's basic human rights that anyone that's incarcerated is granted. And especially in jails, these people may not be guilty. They are awaiting trial. They are waiting to prove their potential innocence. And so that is one major part why I think, and I understand why some people that maybe don't know anyone that's ever been incarcerated may not understand how important it is that these individuals are still getting treatment, but it's basic human rights is what we're talking about. And
Right.
if you want to look at it in a different way as well, if these individuals are not getting properly treated while they're behind bars, and if they get out after, a plea deal or something briefly where they're out after being punished for a crime, if they're not mentally treated, they could just continue to commit crimes. And that's what we see a lot with repeat offenders.
Right.
Is people suffering from mental health illnesses. And so if we're not addressing this in the beginning, it's just going to continue the cycle.
Yeah. Throughout all of your reporting, what is your takeaway from all of this?
That's a great question. I think my biggest takeaway is just shining light. I mean, I think mental health in general is not talked enough about throughout America, throughout everyday people like us, even journalists, but also the people that don't have their voice because they're locked up. They don't have the same means to go walk to a neighbor's house and say, hey, I need help. I think it's really wanting to be the voice for those individuals and the voice that for the people that aren't even here any longer, like Forrest and Jordan, being able to say, hey, we need these resources and here's why they already should be given to inmates, that they should be given these resources without having to beg for them. It should be kind of a guarantee when you're locked up and behind bars.
All right. Excellent reporting as always, Emily. Thank you.
Nick.